Hey guys, welcome back to Care Zone. If you have not subscribed already, please do and turn on your notifications so you don't miss any of my videos. In this series, we've been talking about early disease detection, and we have discussed the benefits of detecting hypertension and diabetes early. And today in this video, we'll be talking about early detection of cancer and the benefits and how to achieve it. Like I've always said, early detection is the best prevention. So let's dive right in and learn how we can achieve this. Cancer is a disease in which the body cells begin to grow abnormally and uncontrollably, and they begin to spread to other parts of the body from wherever they have started. And they can start anywhere in the body. So depending on where the cancer growth is occurring, cancer growth can damage the digestive system, collapse the lungs, damage the kidney, the liver, the brain, the skin, and any other part of the body that is involved in life's functions. And that is how cancer kills. Cancer, according to the World Health Organization, is the second leading cause of death in the world. The most common cancers are cancers of the breast, the lungs, the kidney, the bladder, the cervix, the prostate, and the rectum. But how common is cancer in Nigeria? According to a 2020 report by the World Health Organization, there were about 115,000 cases out of a population of 200 million in Nigeria, and over 70,000 deaths were recorded in that year. This is just an estimate because there are so many unreported cases. There are so many deaths that have occurred which were unreported and undiagnosed. And in fact, this video you are watching today is because of that number, those unreported, undetected cases of cancer. We can't afford to be unaware. We need to detect this disease early because survival of cancer is directly linked to early detection of cancer and commencement of treatment at the very early stages. Experience has shown that survival rate is much higher when cancer is detected early. For example, with breast cancer, there is a 98% chance of survival if it is detected at stage 1, compared to a survival rate of about 19% when it is detected at stage 4. So generally, this disease can be tackled. You can beat cancer if it is detected early and treated early. The importance of spotting cancers very early cannot be overemphasized because cancers can start forming and growing in the body for years, and they can stay undetected until a serious damage has been done to the body. And the only way to spot them very early is by screening, because sometimes they don't show any symptoms, or maybe the symptoms may be subtle or maybe looking like symptoms of other diseases, and they are therefore mistaken or ignored. So screening is the only way to spot cancer early. There are various tests that can be done depending on the part of the body that is targeted. For example, we have mammography for detection of breast cancer, we have pap smears for cervical cancer, and all of these tests will be recommended by your doctor based on the risk factors that have been evaluated by you and the doctor. So based on your family history, your age, your occupation, and other exposures you may have had, it is possible for the doctor to recommend various tests for a person based on these evaluations. So if you would like to get screened, you can let me know in the comment section. And also, if you go on the internet, if you make some research online, you will find out that there are many organizations dedicated to cancer awareness and screening. In fact, there's one of them I found, Cancer Aware Nigeria, and they have a lot of screening centers in Nigeria, and you can find a location near you for your screening. And before they carry out these screenings, they also do some counseling and education of the individuals who will be tested. They will even explain to you what those tests are and what you should expect during those screening or diagnostic tests. But please note that this is not an advert. So you can go online, you can also visit your doctor, go to your hospital, talk to your doctor so that you get recommendations on what is best for you and whether you even need a cancer screening at all. All of this will be evaluated and recommended by your physician. So how can you achieve early detection of any type of cancer? The very first thing you should do is know your risk factors, and that's why we're watching this video today. You need to ask yourself, what are the things that can predispose me to cancer? These might include your family history, your age, your environment, your occupation, and any other genetic predisposing factors that we may have, or any other underlying conditions that may exist. Also, your lifestyle. For example, a smoker or a heavy drinker may be at risk for cancer, and it is important to know these risks and find out if it's necessary to get screened or even get tested with the aim of diagnosis. The second thing to do is to get screened or tested. The American Cancer Society recommends that from the age of 35 to 40, men and women should begin to screen for cancers of the breast, the colon, the prostate, the rectum, and the cervix. The next thing to do is do not ignore the body's signals. You see, when it comes to symptoms and body signals, it can really be tricky, and that is because some symptoms may look like the symptoms of other diseases. If you don't check, you will not know. So when you are having constant sleep disturbances, persistent cough, diarrhea or constipation that refuses to go away, or you have trouble sleeping, or you have jaundice, yellowing skin or eyes, or you have headaches, constant headaches that refuse to go away, or you have a cough that refuses to go away, all of these symptoms should not be ignored. It is best to report them and get screened. And if it is not cancer, then it could be something else that also requires attention and should be treated. But if it is cancer, then it is presenting you with an opportunity to detect it early, diagnose it, and begin to treat it early. And that is how those who have beat cancer in the past actually succeeded in doing it. So it is possible to beat cancer if and only if it is detected early and treated early. Another thing you can do is get the HPV vaccine. That's the human papilloma virus vaccine. But that is only if you are below the age of 26. The vaccine can help prevent cancers that are caused by the human papilloma virus, the HPV. Another thing we need to do is adopt a healthy lifestyle and diet, and also increased physical activity. We also want to avoid processed foods, alcoholism, smoking, and contact with toxic chemicals, or avoid staying in a toxic environment or an environment that is highly polluted with toxic materials. And so what are we supposed to be doing? There are foods that can help to prevent cancer because they mop up the substances that accumulate within the body to cause cancers. Such foods are tomatoes, onions and garlic, ginger, leafy vegetables and greens, whole grains, fish, and lots of water. It's also important to get enough sleep, because if you rest well, then you will have a healthy body. So all of these actions will help to prevent or delay the onset of cancer. So it's been a long discussion, and I'm so glad that you're still here and you've been watching this video. Do not watch without acting on what you have seen today. Experience has shown repeatedly that early detection of any kind of disease at all is the best way to beat and kick out those diseases. Cancer is also one of them. So never allow yourself to be caught unawares by any disease at all. So to get more information about how you can enjoy the best quality of life in good health, please subscribe and turn on your notifications so you don't miss any of my videos. Till I see you again in my next video, I remain Grace, your Care Zone pharmacist. Stay healthy and stay safe. Bye.